we started already in 2010 to identify that personalized medicine is something that we really need to focus on at European level. First of all, because we have an aging population. We also have rising healthcare costs, and we need to see how we can optimize the health outcomes and also how to make sure that the healthcare systems are very highly performing. So this was really sort of the motivation to start, and we started with a number of workshops that led to a first conference in 2011, a second one in 2016, and with the establishment of PerMed. And then we have a fantastic collaboration going on in PerMed, which is of course then supported by the PerMed, and also by the different funding programs that we do have also from the European Commission, and also in terms of policy developments to support, in particular when it comes to more the uptake and the use of personalized medicine. We have invested very heavily over the last 15 years into personalized medicine from the EU Research Framework Program, starting from FP7, Horizon 2020, and the current program Horizon Europe. And we are funding it in different ways. So first of all, we are co-funding the partnerships. First the ERA PerMed, and then also the PerMed. So we are a contributor, quite significant financial contributor to that program, which then is also leveraged with funding from all the partners in that partnership. But we are also investing in other partnerships that also contribute to personalized medicine development. So I would like to mention, for example, in rare diseases, we have in transforming health and care systems, we have the cancer mission, and there are many different types of partnerships that are really supporting the development of personalized medicine. Even if maybe the research as such isn't called or branded personalized medicine, it actually do contribute to generating more knowledge and generating more evidence. We are also funding projects directly from the collaborative research program, and also from our other tools like the research infrastructures, of course, which has a very, very important part in supporting the research that is being done. And also we have the European Research Council, of course, is funding much more basic research, and the European Innovation Council, which is funding much more the innovation side and small companies in particular. In addition, we have the public-private partnership, the current one called IHI, the Innovative Health Initiative, and that brings together the European Commission together with the health industries. So we have the pharmaceutical industries, the biotech industries, the medical technologies industries, the imaging, diagnostics, etc., and also those dealing with health data. So that is also a very strong collaboration that also contributes to the development of personalized medicine. So we're using a whole arsenal of different tools in terms of what we are doing on the research funding side. But of course there are also other policy developments in terms of, we have the pharmaceutical package, which is currently under negotiations with the member states, and there are also other regulatory developments in pipeline. First, I would like to go to the past, and that's when we started the journey in 2010. And we started to organize workshops with different stakeholders to identify a little bit what needs to be done. And at the end of each one of these workshops, we asked, so what do you think that we should do? And it was interesting because they did not say, invest more funding into this. What they said was actually convene more meetings like this, because we need forums where all the different stakeholders can come together and discuss. Because often when you organize conferences, etc., they are organized maybe in sort of a disease-specific area or in a scientific area. And here, sort of, we help to catalyze, this collaboration and discussions. And I think that in addition to all the funding that we do through the European programs, it's still a very important role that I think we do have from the European Commission side, and that is really to stimulate and catalyze the discussions and collaborations that comes out from this type of workshops, etc., that we organize them. And the PerMed is a result of this type of meetings, actually. So I think it's a very, very important aspect that often is forgotten. 2030 is basically tomorrow when it comes to health and how to bring innovation, out into the real life. So 5 years is a very short period, but of course we have 15 years of work that we can harvest on. And what is really important is to continue to build the evidence-based, both of course the clinical evidence, demonstrating the value for patients and for citizens of the personalized medicine approaches, also of course to clinicians and the healthcare providers, and also work also on the more health economic aspects. We need to do much more in terms of understanding what are future types of regulatory systems that we need to sort of speed up and foster the development, and also in terms of health technology assessments, etc. So it's very much, we need to really come together now and reflect on how do we ensure that everything that we have developed so far and that are being developed right now rapidly can come to the benefit of the citizens. And for that we need to have the evidence base there, and we need to show how personalized medicine can make health systems more efficient than they are today, and also cost efficient, and of course to improve health outcomes for the individuals who are affected by one or the other area. The other area that we need to do a lot more work on is of course also on prevention, because that is really, with increasing costs in health systems, we need to try to keep people healthy as long as possible, and whatever we can prevent, we should try to do that. And that is a lot of work that still needs to be done, but we will need to continue. But we should really make sure that we can harvest on all the discoveries and all the good work that has been done up to now to make sure that it really comes to the benefit of the citizen.